So what I'd like to do is to give you a very short update, about 10-15 minutes, about the National Autism Center. So I think many of you have either been here last year or yesterday and other places and already know some of the basics. It's really important for me to mention that funding for this conference is happening in part through the AIMS 2 project and TIVA. And so Sharon already mentioned the process through which we became the National Autism Center. I just wanted to mention that this was a groundbreaking change in the sense that it's the first time that an entity from the Israeli government decided to invest in infrastructure for autism research in Israel. This concept of investing in infrastructure that is shared and that will serve not just us at Ben Gurion, but everyone in the country, and that's definitely the goal, is really important and is really new in Israel, and started about 1.5 years ago. So you can see our vision here on the slide, right? The vision is to promote the development of both diagnostic and therapeutic tools for autism, and to turn Israel into a leader in discovering new tools and also implementing the effective ones. That's a really important part. So a lot of you know that Israel has a lot of social systems, right, in both terms of healthcare and education and many other aspects. And so having the right information in order to make the right choices for these programs is a really important issue. We discussed a lot of that yesterday, and we hope to get more into that in the very near future. So when we think about this infrastructure, a central component of that, which is marked here in red, is this database. So databases are really, really good ways to create collaborations, and they're an essential tool in autism research. There are many of examples for why they're so essential across the world. I won't elaborate too much about that, but I think everyone in the room here knows that autism is very heterogeneous. There are many different flavors and forms of autism, and so it doesn't make sense anymore to do research on autism in individual isolated labs. We have to work on much larger samples, on community samples, on populations, to try and figure out different subtypes of autism and what works best for whom. And for that, you need a really big database, and that's our main pillar for this whole story of the center. In addition to that, you can see some other focuses of activity. Through conferences, we're trying to foster a vibrant research, scientific and research community, etc. So when you think about this database, the way, at least the way we approached it, was to take advantage of a huge benefit or opportunity that's available in Israel, which is the clinical services. The social clinical services in Israel are great. They're accessible. And there's really a wonderful network of Tipot Chalav, and if you know what that is, and infant wellness centers and child development centers and preschool psychiatry units. And so the way that autism is diagnosed and then followed up in Israel is through these places. And they act as a sort of a funnel where all of the families who get all of the cases of autism go through. And so this is a great opportunity for research. If you integrate research into those settings, you actually can create an amazing collaboration that both sides, this is a win-win situation. The clinical services, right, they benefit from having access to this research, from maybe improving and having up-to-date information about how to best do the diagnosis, how to be more accurate. And the research community has a lot of access to families and to very critical information for gathering this information in a structured manner into a database. So that's exactly what we've been doing. You can see here, we had a big discussion last year at the conference about what should be in the national database. You see what we've been up to so far. We started collecting this data before it turned into the national story, already in January 2015. So today, all of the children who are diagnosed with autism in the Negev undergo an assessment that includes tests like the ADOS, which is an entry ticket into research, right? The ADOS is a structured test for an internationally standardized structured test for autism. You can see the numbers. We've added a variety of other types of information along the way. And a really important feature of this database and of the way the clinical system in Israel works is that there are annual follow-ups. So every year or two, the families come back to the same location for a follow-up clinical assessment, and that allows us to do things like do a follow-up ADOS that you see here on the bottom. And this longitudinal collection of information is super critical for looking at development, right? And we're very, very interested in understanding why some children develop better, other kids do not, why symptoms improve in some cases, deteriorate in others. And so this is a critical component. You see a bit of the statistics of this sample that's now over 1,000 individuals in size. There's an interesting story about the Bedouin community in the Negev that I think most of you know, but I'll just reiterate that 2/3 of the parents of the Bedouin kids in the database are first cousins, which is a very unique situation to be doing genetic research in. The vast majority were born in Soroka, as Dr. Dreyer said earlier. Soroka is like a medical monopoly in the south, so that makes it easy to go back and look at information from pregnancy records and other medical interventions that were carried out. This is another way of looking at the data. You see some more details here of additional types of studies that we run. We found out something really surprising, that about 20% of the kids with autism, at least in the Negev, have undergone brain MRI scans for clinical reasons, which was a bit of a surprise. We assumed that the numbers are going to be similar in the rest of Israel, and that's actually a very big opportunity to look at brain research. There are lots of anatomical scans and in some cases DTI scans. We have a large, a growing group of families who have undergone genetic sampling. So this is Dr. Ilan Menashe's project, together with Professor Joe Buxbaum, who you'll hear from in a moment, who runs the Autism Sequencing Consortium. We're sending samples from these families to the NIH for whole exome sequencing, and there's some very interesting results that are coming back. Right, and other large types of data. This is the different follow-up data. We do a lot of work with technology that I don't have time to get into. This is the team. I want to make sure that you know everybody. So sitting next to me there is Dr. Ilan Menashe, who is a geneticist and epidemiologist. And then next to him is Dr. Gal Meiri, who is the medical director, who runs the preschool psychiatry unit at Soroka and has performed many autism diagnosis over the years, and Professor Chava Golan, who is a molecular biologist and works with preclinical models, with animal models and metabolites, and we joke that she's the real scientist. She has a white coat. And next to Chava is the most important person in this room, is Mazal Menashe, who actually organized this conference. Oh, did I say Mazal Menashe? Well, yeah, you see the stress from the 2 days of conference. So Mazal Malka, who is our wonderful administrative manager, and you can guess how much work went into creating this 3-day conference, and she gets all the credit for that. Okay, so in turning this from something that happens mostly in Be'er Sheva to a national center, we've been working very hard on creating collaborations. One of the advantages in Israel is that autism diagnoses are rather confined to not a huge number of locations. And so, we did a little calculation. It would be enough to have the center work in Be'er Sheva, Asaf HaRofeh, and Tel HaShomer, and it would already capture about half the kids that are diagnosed with autism every year. And so, I also wanted to make sure that you know all our clinical partners in Be'er Sheva. So together with Gal Meiri, we also work very closely with Dr. Analia Mikhailovsky and Dr. Chagit Flusser, who run the Child Development Center in Soroka, and with Cheni Steierman, who runs the Child Center of Maccabi, and Yair Tzadaka, who runs the Child Development Center of the Health Ministry in Be'er Sheva. Those are all the locations those are the only locations where you can get an autism diagnosis in the Negev, which is 70% of the land mass in Israel. So that's worked amazingly well for us, and there are wonderful relationships. So the center operates captures information from almost all of the children. The next step was to develop outside Be'er Sheva, and so we've been very fortunate to create a working collaboration with Professor Ditza Tzachor, who runs the Aleut Autism Center in Asaf HaRofeh, which is a huge center. There are about 250, 300 cases a year, new cases of autism that are diagnosed there. So we've gotten all the approvals. There's a research assistant from the center who spends time there on a weekly basis and inputs data to an identical database. So for all purposes, there's now an identical database in Be'er Sheva and Asaf HaRofeh for capturing the same information in the same structured manner. And that is super useful for research because we can aggregate all of this. And a similar process is happening also with Dr. Michal Begin, who runs the Child Development Center of Leumit in Jerusalem, and we hope to finalize that in the following weeks. I just wanted to say a word about, in each of these sites, right, the idea is not to add additional work to the clinical teams. We take care of all the additional work. We supply the research assistants. We supply any help that's necessary for collecting ADOS assessments that might not be the routine. We also buy and install. I personally come and install. I have a handyman set for installing cameras and microphones in the rooms at these child development centers. So we do a very thorough job of trying to capture information from these children during all of their assessments. And then after all of the IRB approvals are set and this infrastructure is in place, it's a very easy process to then add on additional research like collecting genetics, bringing in an eye tracker and collecting additional data because the research assistants are already there, everything is set up, and those things will happen much more easily. So if you happen to have a child development center and this speaks to you, then please come talk to me at the end. Okay. The other collaborations, I'll just say a word with Aleut and Children at Risk. We're creating now what we call a smart daycare center in Be'er Sheva. This is a pilot project of introducing technology into the Alutaf and collecting information throughout the year as the children develop in the Alutaf. We want to develop these tools that will help the clinical team be able to assess the children on a weekly basis to know if the symptoms are changing for better or for worse. It's a long story. And then there are several other collaborations that are more on the research angle. So with Dr. Adi Aran at Shaarei Tzedek, who is probably the world leader in studying medicinal cannabis, we're now helping him add a genetic component to the research. So doing those exome sequencing studies. With Dr. Orit Stoller at Asaf HaRofeh, who is now still recruiting families for another medicinal cannabis study. We're also helping with EEG analysis and sleep analysis and other things like that. With Dr. Judah Kola from the Hebrew University, where we're going to start some early intervention research and bring it down here to the south. And of course, with Professor Tzachor, we have a lot of different ways of looking at this data that we're now collecting across the centers for better understanding diagnosis and development.